Project 6B. A natural birth simulation, twin delivery. The requirements for Project 6B closely mirror those of Project 6A. However, as this project simulates a natural twin birth, students will need duplicates of specific items such as both tiny babies, hemostat clamps, 2 cord clamps, 2 welcome baby cards, 2 neonatal ID bands, 2 APGAR scorecards, and 2 neonatal checklists. Additionally, the 24-inch balloon will be used in this simulation instead of the 18-inch one used in Project 6A. Extra APGAR scorecards and neonatal checklists can be printed as needed. Follow the same preparation steps as in Project 6A, but place 2 babies into the 24-inch balloon. Remember to position the babies into the cephalic occiput anterior position if necessary. This project requires an extra L&D nurse, if available. If not, both the obstetrician and the assistant can take on the roles of the L&D nurses after delivery. The assistant will replicate the steps from Project 6A to simulate uterine contractions, facilitating the delivery of one baby at a time from the balloon. After the first twin is delivered, the second twin may need to be repositioned into a head-down position again before guiding it into the birth canal. The obstetrician will deliver each twin safely, following the same procedures as in Project 6A. If an uncomplicated delivery is being simulated, the cords will be clamped and cut only after both babies have been delivered and kangaroo care will be observed. If either of the babies show signs of distress, the umbilical cords will be clamped and cut without delay, and medical assistance will be given. The placentas are delivered last. Both L&D nurses manage each neonate individually by following the same procedure as described in Project 6A. If conditions permit, twins may be placed in individual warmers or together in a larger one, depending on their stability and the facilities available.